Disorganization of retinal inner layers is an OCT biomarker identified by Dr. Jennifer Sun and colleagues from the Joslin Diabetes Center in Boston. Sun et al. Defined DRIL as the horizontal extent in microns for which any boundaries between the ganglion cell inner plexiform layer complex, inner nuclear layer, and outer plexiform layer could not be identified. These criteria do not change regardless of the presence of other OCT findings. Sun et al. Found that foveal DRIL, that is DRIL affecting greater than or equal to 50% of the central 1 mm wide zone centered on the fovea, to be associated with reduced vision regardless of whether the edema was concurrent or resolved. They also found a one-line reduction in vision for every 300 micron increase of DRIL in the central 1 mm foveal region, and found this correlation of vision change with a change in DRIL to be more robust than any other OCT parameter. DRIL is not an acute finding and only occurs in patients with disease present for greater than 6 months. The presence of DRIL is not restricted to diabetic macular edema, but has also been found in other causes of macular edema such as retinal vein occlusion. However, Radwan et al. Noticed that the association of DRIL change with vision change was present only in central diabetic macular edema. Costa et al. Found that the presence of DRIL at baseline was a major risk factor for the recurrence of macular edema in vein occlusion. DRIL may be reversible, and there is a better final visual prognosis for patients in whom the DRIL resolved. DRIL is believed to be due to vascular changes resulting in ischemia. The clinical significance of the presence of DRIL is that it explains why vision is still poor in cases of resolved edema when present, and the presence of DRIL before treatment of edema warns of a guarded final visual prognosis. It is surmised that DRIL involves the destruction or disorganization of amacrine, bipolar or horizontal cells in the inner retinal layers, which are critical for transmission of visual data from photoreceptors to retinal ganglion cells. Recently, Muller cell involvement has also been suggested.